2020-2021 post-vaccination embolic and thrombotic events are rare types of blood clotting events that have been observed in a very small number of people who had previously received the Oxford AstraZeneca COVID-19 vaccine during the COVID-19 pandemic. On the 13th of April 2021, AstraZeneca and the EMA updated their information for healthcare professionals about the vaccine, saying it is considered plausible that there was a causal relationship between vaccination and the occurrence of thrombosis and thrombocytopenia, and that, although such adverse reactions are very rare, they exceeded what would be expected in the general population. The syndrome healthcare professionals and people receiving the vaccine have to be aware of is a combination of blood clots and low levels of blood platelets occurring in the period between about day 4 and 2 weeks after vaccination. Other symptoms include shortness of breath, chest pain, leg swelling, persistent abdominal pain, neurological symptoms, and tiny blood spots under the skin beyond the site of the injection. It should be noted COVID-19 vaccines have some adverse effects that are listed as common in the 2 or 3 days following vaccination, which are usually mild and temporary. Blood clots occur at a background rate in the general population, though the combination of low levels of blood platelets with blood clots is seen more rarely. Regulatory authorities have detected a very small number of such events after COVID-19 vaccinations, at what may be higher rates than expected, sometimes accompanied by bleeding. These events have led to the Paul Ehrlich Institute has recorded 31 cerebral venous sinus thromboses and 9 deaths out of 2.7 million vaccinated in Germany with the AZD1222. On the 2nd of April 2021, the UK's Medicines and Healthcare Products Regulatory Agency reported 22 cases of CVST and a further 8 cases of clotting problems, both associated with a low level of blood platelets, following a rigorous review of its yellow card reporting. The institute also reported finding no events of this type which occurred after vaccination with the Pfizer-BioNTech COVID-19 vaccine. The EMA had earlier said that a link between certain very rare blood clots and the AstraZeneca vaccine is not proven, but is possible. Observations in Germany of these rare events seem to relate mostly women aged under 55. However, because Germany had previously restricted AZD1222 to under 65s, the population vaccinated there with AZD1222 was comparatively younger, and consequently contained a higher proportion of women taking the contraceptive pill, as CVSTs are more likely in women using hormonal contraceptives. This inherent risk factor may be an influence on the reported preponderance of women experiencing these events following vaccination. The UK, in contrast, has applied its Pfizer and AZD1222 vaccines generally to older groups first, then by decreasing age. According to the European Medicines Agency, as of the 28th of March 2021, the reported rate of such events was lower than in the general population overall, but higher than in the population prior to the pandemic. The EMA also said that there is no proof that these events are caused by the vaccines, but that the possibility could not yet be ruled out completely. Accordingly, the EMA advised that people who received the vaccine and experienced symptoms suggestive of thrombosis, including shortness of breath, blurred vision and severe or persistent headache, should seek medical attention. In a press briefing in the afternoon of the 7th of April 2021 by Emma Cook, Executive Director of the EMA, began by stating, "Our Safety Committee, the Pharmacovigilance and Risk Assessment Committee of the European Medicines Agency, has confirmed that the benefits of the AstraZeneca vaccine in preventing COVID-19 overall outweigh the risks of side effects. COVID-19 is a very serious disease with high hospitalization and death rates, and every day COVID is still causing thousands of deaths across the EU. This vaccine has proven to be highly effective. It prevents severe disease and hospitalization, and it is saving lives. Vaccination is extremely important in helping us in the fight against COVID-19, and we need to use the vaccines we have to protect us from the devastating effects." She went on to say, "The PRAC, after a very in-depth analysis, has concluded that the reported cases of unusual blood clotting following vaccination with the AstraZeneca vaccine should be listed as possible side effects of the vaccine. At the same briefing, Dr. Samina Strauss of PRAC confirmed, "Our conclusion is that these clotting disorders are very rare side effects of the vaccine." The UK MHRA also held a news conference on the 7th of April 2021, and while there was no proof the AZD1222 vaccination caused the rare blood clots but indicated the possibility of a link was getting stronger. The UK was to offer under 30s alternative vaccines. The reasoning was because in the 20 to 29 age range the Bene